and I was a Sierra Club fellow. Sierra Club is an organization that addresses environmental issues. I was on my way to being probably the first African astronaut to reach the moon. Those were my childhood dreams, and I was doing mechanical engineering and kind of thinking this is a career path for me. I'm just going to accumulate as many fellowships as I can, go to Rwanda, do a project, impact people, and keep on going up a ladder that I thought, was meant for me. But when I came back home from Oklahoma where I was studying, I realized that whereas I was up the ladder maybe by a few steps, there were other people very close to me, including my own family, who were struggling with the most basic things. And the biggest need was water. And so try to explain this. If you look at Rwanda on the map, it's full of lakes everywhere, springs everywhere, it's green, it's not the Sahara Desert, so why don't we have water? I woke up days and we look in the, I'm about to go take a shower, and there's no water. And I'm like, wait, what, is this a joke? Like, are you hiding the water? And it completely reminded me how life is like. I'd been only away for 2 years in the US, but I came back and was hit by this shock that I couldn't function without water, but that it was a reality I just had to get used to again. So I went back to school, and I had the opportunity to raise some money and come back in Rwanda, and I knew it had to be water. In that it was scarce for some reason. And I've always been a person who believes things are simple, although people just make them sound difficult. So I'm like, we're going to provide water, and it's going to be simple. But what I realized was it was an issue that was all over Africa. Water is still there, but it's harder to access because we're moving. You can't live in a valley because there's malaria there. You have to go live uphill. And if you live uphill, that means you have to walk downhill every day to collect your water. You live in cities, pipes get connected, but you barely have water because pipes get broken. The people who are in charge of the water somehow are not doing their job right, or they don't have enough water to pass around. So things were complicated in that sense, but I always thought we can make a simple solution that could be scalable. And that required understanding the problem. So it's not about physical water scarcity, it's about the lack of infrastructure to access that water. We're finding water that's very dirty. It's a problem everywhere. We're putting too many chemicals in our water. We're adding so many things, creating a scarcity that shouldn't be there. And I teach a hydrogeology class, and the question I like to ask students who are up to become water warriors all over Africa is how much water was there when the earth was created versus now? Is it more or less? And the answer is always, there's definitely less water because they know the problem that's in their community. But isn't it amazing to know that the water that was there is still the same amount that's here? And for me, it's a comfort to know that there is a solution. Now, water has to do with many things. And when we started in Water Access Rwanda, we started off as a non-profit project. And I went to this area in Rwanda called Ngoma District. And the reason we went there was because we first had money. We talked to the Ministry of Infrastructure, and they were kind enough to sign an MOU with us for 3 months to provide water to that particular district. And we went there because they had a lot of lakes. And then those lakes had crocodiles. And if you kill a crocodile, you're fined because crocodile attracts tourists. And you're fined 1 million Rwandan francs. If a crocodile, it's a person who's there just to get water. They pay the family 200,000 if it's a child, or 300,000 if it's an adult. I read that, I'm like, no, this is socially unjust. So we went to that area to provide water so people didn't have to face death or no water. But then when we arrived, I was driving up this road, and there were boreholes everywhere. Boreholes not working. The ones that were working, you would see people pass the borehole, go down to the river, and start drinking from there. And I remember clearly asking this one woman, why are you drinking that water? There's clearly a person washing their bicycle there. There's even a guy putting soap in the water right there in the river. And she's like, no, it's fine, he's my husband. And so that was for me, I couldn't believe it because I was coming from that vision. I'm Rwandan, and I grew up in the city, but also spent a lot of time in the rural areas. So I realized there was a big disconnect between what I was telling myself and what these people were experiencing, my people who we speak the same language, but suddenly there was a big disconnect. Wells would break and people just pass the well and go to get water. Nobody thinks of repairing. If a tap breaks in my house, we call a plumber, we pay him, and then he fixes it. But there's been this perception that water is free and that it should be free. And it's reinforced by so much money being put in water. So when at Water Access Rwanda, we made our mission to be very simple. We were going to solve the problem of infrastructure being put in place and then going unrepaired. And we're also going to involve the community to understand what do you actually need, which later I learned was called human-centered design. And then we were going to create employment. Mathematically, two negatives make a positive. So I was looking at two problems we can combine and then solve the issues. And one of them was we had a lot of free labor, a lot of young people who were unemployed, and then we had water issues that were infrastructure issues. So can we involve those young people to provide the water? And we wanted to tackle poverty, starting from water, because water causes diseases reduce time spent actually working and earning money. They hinder education, they hinder health, maternal mortality increases, childhood mortality, which leads to a bunch of problems. But in the end, people are trapped in a cycle of poverty that's fueled by the availability of bad water and the lack of clean water. And youth underemployment was a big issue. One of the first employees we had with that nonprofit project we started with was a friend of mine. His name was Richard. I met him when I came in the summer, and he was, I was still young. We were like 20, and my friends are texting like, hey, let's meet at this person's place. And then, we're like, he messaged me like, oh, what are you doing? And he was like, don't tell him where we are. And I'm like, why is everybody against him coming? And it's because he developed several addictions. He was the person you find at every bar, always drunk, coming to people's places, misbehaving. No jobs, he was 28. And I wondered, what's the root cause? How can I address that? So I said, hey, do you want to work? And I thought, because we're working in such a remote village, if he comes, he'll be away from all that. But it turned out, there was even more drugs in the village. But when he was there, he started working. I wasn't paying him. I actually told him, if you're really serious about this, grab a mattress and follow me. And we're going to go and drill wells. And then he grabbed the mattress and came. I wasn't sure he was going to stay, but at the end of the week, I was going home for Sunday, and then he's like, yeah, I'm not going to come. I think I'm going to stay the weekend. I come back the next week. He's outperforming everybody, so I start paying him. And at the end of the month, he hadn't been in a bar. He hadn't smoked. His addiction was gone because he was busy doing something else, working. And it wasn't sustainable because we had to stop the project at some point. But it made me realize that young people, it's almost we have a time bomb on our hands. If we don't employ them, if we don't give them meaningful employment, we risk them being involved in something that has meaning, but that's not necessarily good. So far, my company has employed many young people. Right now, we have 12 full-time employees, and we're actually openly hiring 3 people, which I think next month we're announcing other 3 positions. And we hire a lot of local workers. So at any day, even now, we have 16 to 30 people that are involved in our different projects all over Rwanda. So we have a service portfolio and products that are all cheap and want to guarantee access to clean water to everybody. And these are all were creative in some ways and involve the community and learning the problems that were facing the water sector. We started drilling manually because most good water in Rwanda, the one that doesn't contain minerals and metals, was found before you reach 30 meters. So people had this big machine that can drill 400 meters, but they were never using them for that. But to mobilize them, arrive on site and so on, a borehole was costing 15,000. So we're now drilling manual boreholes. They take us a week to finish, which means we actually employ people. And the borehole is going to cost $2,000 instead of $15,000. And then we brought filters, hollow fiber membrane filters, which can last a family 1 to 5 years. They're not new technology, just being given to people in Rwanda and made available to them for purchase. We started surveying using very affordable tools, which I learned from a research paper. And each kit now costs $1,500. And when we started drilling, people were charging me $1,000 for a survey. So we can now offer surveys for $100, $300, or for free if you want. It's very cheap. And then other simple things that we kind of just imported and started doing them as young people who are interested in making a lasting influence. But we still face major issues. The wells we're doing are still getting unrepaired like before because we don't have the necessary capital or the necessary money to keep somebody in the community always raising money for people to keep using the well. So it was always the price we're charging for water is not enough to finance all that. It's not enough to finance the repairs because actually rural communities are expected to pay more for water than urban. So people still had to walk long distances to the water because one well on a map looks like it's serving maybe 1,000 people, but really it's serving the 100 who live right around it. And we then recently worked on something which is a groundwater solar kiosk, runs completely on renewable energy. Water is piped from the borehole right there, that a source that's created there. It's meant to last a long time, up to 20 years. And then it has a prepaid meter that collects payment over mobile money. So we have on mobile money, we're not using M-Pesa, but the one in Rwanda, we don't have M-Pesa in Rwanda, but it's similar things. And the meter allows the kiosk attendant to be somebody who could be disabled or somebody who doesn't need to kind of do much work, just be there to protect the infrastructure. And so we're selling water that's completely purified, chlorinated, UV purified, all the good things you read on your bottled water, but it's completely cheap. So it's 1 franc per liter, which bottled water, to give you an example, is 500 francs for a 500 milliliter. So it's 1 franc milliliter, but we're doing 1 franc a liter. And a lot of this money is invested back into the community, so they go from the kiosk to having tapped water in their compounds. So whenever I present this to investors or government, they're always like, that can't work. And then I showed them the financial projections. This is a model village, which is kind of, in Rwanda we have model villages which are supposed to be ways to demonstrate how we want people to live. And in an example model village, you may have 300 households per village. And 1 kiosk of ours can go up to 5 villages combined together. But here I'm taking a model where we have 1,500 households and making a few assumptions, which include the amount of livestock people have. And actually, when we're going to the field, we're exceeding our assumptions. We're very conservative with this. But you can see that in 5 years, the profit is $104,000 US, when the cost of having the infrastructure there to begin with is $50,000. And this profit includes the money that was reinvested. So this is by assuming that only 50% of the people buy water from us, and that they buy 1 jerrycan of water per day, and that they're buying water for their cows, and only one family, 50% of the families have a cow. So you can see it makes sense. And if you just want to break even, which most nonprofits are interested in, you can implement this for only 155 households and still have, the money back within 5 years. Sorry, break even within 5 years. And now when we compare with traditionally how we've been providing water in Rwanda, I got some quotations from WASAC, which is the Water Sanitation Corporation, which works with government. And they gave me quotations to bring water to a few points where we're putting our kiosks. So you can see it's in Rwandan francs, but for example, the worst case was Nyagatare, where they were charging 185 million to bring water, but our kiosk there would only cost 21 million Rwandan francs. So it's a completely cheaper investment. It's gonna make more money. It's gonna help the community grow. It's gonna help us achieve SDGs to the point where everybody can have water within their households. And so definitely we want them to work with us. And We're proving out, we have 2 pilots right now that we've been tracking for 1 month, and they're already exceeding our numbers. So we're wanting to see how this works out before we actually start accepting investment. But yeah, that's it, and I hope soon enough you'll see Numa near you in your countries as well, not just Rwanda.